Good evening, everyone, and welcome to Cucamonga Valley Medical Group's Healthy Living webinar. My name is Sabrina, and I am a community health educator. Thank you for joining tonight. Remember that this webinar is interactive, so please feel free to talk to me, communicate with me. I have the chat function open and the Q&A open, so you can ask me questions. I also save some time at the end of this webinar to have a Q&A session, so you can save your questions until the end as well. This month's Healthy Living topic is heart health. It's heart health. Your heart works every second of every day. It never rests. And as we know, the heart is one of the most important organs keeping us alive. When your heart stops, all other parts of the body will begin to fail almost instantly. Knowing how vital your heart is to your life, it is important to do everything you can to take care of it so you can keep doing the things you love. And it is important to note that heart disease is the leading killer in both men and women in the United States. The good news is that having a healthy lifestyle, embracing a healthy lifestyle at any age can help to prevent heart disease and lower your risk for heart attack and stroke. So I like to say it is never too old, you're never too young to begin taking care of your heart. And tonight we're going to be learning just that, ways that you can be taking care of your heart. So first, we're going to talk about heart disease and risk factors, eating for heart health, being intentional on stress management and why that's important. And then we're going to discuss preventative exams that you should be getting to stay in charge of your heart health. And we have a special guest who will actually be discussing these preventative exams, which is our provider, Dr. Perry. So she will be joining us later on in this webinar. Let's watch a quick video on how heart disease develops in the body. It is important that we have a visualization of how this occurs so we know better how to prevent it.
Coronary artery disease is a condition in which the coronary arteries are narrowed by deposits called plaques. The coronary arteries originate from the aorta and supply blood and oxygen to your heart muscle, allowing it to pump blood to the body. Normal coronary arteries allow blood to flow freely. However, these arteries can become narrowed by inflammatory fatty deposits called plaques. This disease process is called atherosclerosis. Atherosclerosis that occurs in the coronary arteries is called coronary artery disease. These plaques build up over time and can decrease the amount of oxygen reaching your heart. Mild coronary artery disease may develop over decades without any symptoms. More severe coronary artery disease can cause chest pain called angina and shortness of breath. If a plaque suddenly ruptures, a blood clot can form and block the heart's blood supply. This is called a heart attack, and it can cause permanent damage to the heart. Over time, severe coronary artery disease can also weaken the heart muscle and lead to heart failure or cause arrhythmias, an abnormal heartbeat.
So what's important to recognize from that video is the plaque buildup in our blood vessels. When we make lifestyle changes, we can affect the plaque buildup in our blood vessels. It's important to know your risk factors for heart disease so you can better manage the chance or your risk of developing heart disease. I'm going to share the risk factors for heart disease. So there's risk factors that are not in our control. So our age, our genetics, our gender. And then there's, oh, hold on, let's share that again. There we go. So then there's other risk factors that we do have influence over. So we can influence our high blood pressure, manage our diabetes, our weight, if we're physically active, if we're stressed out, if we're using drugs, if we're using excessive alcohol, if we're smoking. So these are all risk factors for heart disease. And extensive research has shown that a healthy lifestyle are key factors in reducing your risk for heart disease. Making healthier food choices is one of the best ways you can lower your risk for heart disease. Foods that are high in saturated fats, trans fats, cholesterol, and salts are going to cause that rise of the fat and cholesterol in our blood, causing that plaque buildup, which will lead to heart disease. I'm going to share the 3 best ways that you can eat for heart health. So number 1 is to eat more fiber. Eat more fiber. Fiber is essential to heart health because it lowers blood pressure and lowers your blood cholesterol levels. I like to call fiber the key to health because it also helps you to maintain a healthy weight. It improves your digestion. It helps your body to eliminate carcinogen, meaning it's going to decrease your chance of developing cancer and other diseases. It's important to note that fiber is found in plant foods, So that's going to be foods like vegetables, of course, vegetables, right? So you want to incorporate more vegetables into your diet. Maybe having some vegetable soup, veggie wraps, adding salads to your meals. Those are great ways that you can eat more fiber. Fruits are full of fiber. Having fruits for snacks is a great way to eat more fiber. Legumes, so in other words, beans. I always like to say lean on legumes because legumes are packed with fiber, minerals, and vitamins. They are a true health food. So you want to do your best to eat more beans or legumes throughout the day. And these foods make great foods to make ahead. So I like to always have a pot of beans in the fridge ready to go, some bean chilies. That way I'm eating that much needed fiber. Whole grains such as oats, quinoa, rice, whole grain pastas and bread. Those are great options for eating more fiber. Nuts and seeds have fiber, so including them in throughout your day as well. So those make great snacking options. You can pair them with fruit, sprinkle them on salad. Eating for heart health means eating more fiber. So find ways to incorporate these foods in your day. The second way that you can eat for heart health is to choose better for you fats. Now you might be thinking, hold on, Sabrina, fats are bad. And of course you think that because for years we've been told that fats are problematic, they cause inches to our waistline. Well, the truth is not all fat is the same. There's actually 3 types of fats. So the first type of fat is saturated fat. Saturated fats, these types of fats come from animal products and they are solid at room temperature. So foods that are high in saturated fats are going to be foods like whole milk and cream, butter, cheese, ice cream, meat fats. So meats that are high in fat, so like bacon, processed meats, sausages, pepperonis, palm and coconut oil. So these foods are high in saturated fat. Well, we want to limit or avoid saturated fats. And that's because eating high amounts of saturated fat is going to cause that plaque buildup in our blood vessels, in our arteries. And then that is going to lead to heart disease. So do your best to reduce the amount of saturated fat you are eating. The second type of fat is trans fat. Trans fat. Well, trans fat is actually a man-made fat and is found in many processed and restaurant foods. And that's because trans fats prolong the shelf life of foods and it improves the texture. So that's why food companies like to use it. Well, trans fats have been directly linked to heart disease. And there's so much evidence and research to back this up that the FDA labels trans fats as unsafe. Okay, so nowadays, a lot of food companies and restaurants, they're trying to take trans fats out of their products, which is good, right? But they're still out there. They are still widely used. So you want to make sure that You are reading the ingredient list on the nutrition facts label, and you want to look to make sure that it says no hydrogenated. If it says hydrogenated, that's a sneaky word for a trans fat. And of course, we're going to be looking for trans fat to be 0 grams, 0 grams. And when you're out eating at restaurants or eating out, it's best to choose foods steamed, baked, broiled, or grilled instead of fried, because fried foods are going to be high in that trans fat. Okay? So of course we want to eat less processed food as well. Processed foods might contain those sneaky trans fats, so choosing whole foods most of the time is going to be the best choice. So our third type of fat is unsaturated fat. Unsaturated fats are considered the healthy fats or the good fats, and they're actually essential to your health. They are better for you fats because they lower your cholesterol levels and reduce your risk for heart disease. So to incorporate more unsaturated fats, you can choose foods like nuts and seeds, so walnuts, sunflower seeds, almonds. Olives are high in unsaturated fats, avocados, vegetable oils, so canola oil, olive oil, peanut oil, and fish. So fatty fish like salmon and mackerel, they're going to be high in unsaturated fats as well. We just learned that limiting how much saturated fats and trans fats you eat is an important way to reduce your risk of developing heart disease. And choosing unsaturated fats is going to be better for you by keeping your heart healthy. The last and final way you can eat for heart health is by limiting how much salt you are eating. And I know we've heard this one before, right? But it's important to mention because eating high amounts of salt actually causes high blood pressure. And we have learned high blood pressure puts you at risk for heart disease. The American Heart Association recommends eating less than 1,500 milligrams of sodium per day. So that's the recommendation. You want to be eating less than that per day. And as a fun tip, you can try to flavor foods with unsalted spices, herbs, lemon, lime, garlic. Those are great ways to flavor your foods. Choosing homemade foods, that's a great way to avoid that extra salt. And choosing low sodium or unsalted products is going to be the best choice to avoid added salt. Remember that eating for heart health means eating more fiber, choosing better for you fats, which is going to be that unsaturated fat, and limiting the amount of sodium or salt that you are eating. I don't see any questions. Remember, this is interactive, so please feel free to ask me questions. You can communicate with me on the chat as well. The next way that you can take care of your heart is by being intentional about stress management. And what that means, it just means doing something to relieve stress intentionally on purpose. You're doing something to feel less stress. And that's because when you feel stressed, your body goes into the fight or flight state. And your body releases adrenaline. And that's going to speed up your heart rate and cause your blood pressure to rise. So if you're constantly stressed out, then that means your body is constantly in that state, fight or flight state. And that's going to put a big strain on your heart, right? It's going to make it work harder than it has to. So when we do not manage our feelings of stress, that could lead to us feeling stressed out and turning to unhealthy behaviors. So behaviors like overeating, sitting too much, drinking too much, what is another? Smoking cigarettes. So that's another unhelpful behavior. Can you think of a time that you were stressed out and turned to an unhealthy behavior? Yeah, it is common. And that's why it's important to regularly manage your stress so you can keep your heart healthy and avoid turning to those unhealthy behaviors. You can be intentional about stress management by dedicating some time every day and doing an activity to relieve some feelings of stress. Here are some activities or things that you can start doing to feel less stress. So the first, of course, is exercising. Exercising has been proven to relieve the feelings of stress and anxiety and depression. And physical activity is especially good for your heart health. It lowers your blood pressure and actually strengthens your heart. So it's really good for heart health. And Dr. Majoud, the CEO and a healthcare provider at Cucamonga Valley Medical Group, says that staying active at least 5 days a week is key to strengthening your heart and keeping it free from disease. So this can be as simple as walking regularly or other activities such as sports, weightlifting, dancing, bicycling. Whatever activity it may be, it's going to be good for your heart. So pick an activity that you enjoy and do some exercise to relieve stress and keep your heart healthy. The next is to take time to relax. Take time to relax. Many people think that relaxing is a luxury, but relaxing is actually a necessity. We cannot be on the go, 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 go all the time. We need to give our bodies the time to relax, unwind, and recharge. And when you're relaxing, it slows your heart rate down and lowers your blood pressure. Activities that can help you relax could be things like yoga, meditation, deep breathing, listening to music, reading a book. Whatever activity helps you relax is going to be a great activity to help you relieve some of that stress. So we've talked about eating for heart health and being intentional about stress management to keep your heart healthy. Our final tip is to stay in charge of your heart health by getting your preventative exams. Regular checkups can catch any potential problems early when they are the most treatable. And tonight we have one of Cucamonga Valley Medical Group's wonderful providers, Dr. Perry, who she will be discussing what preventative exams you should be getting. Dr. Perry completed her residency training in family and preventative medicine, and she has a master's in public health. So without further ado, let's welcome Dr. Perry. I'm going to add her on as a panelist. Good evening, Dr. Perry.
Hello, Sabrina. Thank you so much. Good to see you and welcome everyone.
We have our slides of our preventative exams that you'll be discussing.
Awesome. So Sabrina talked about some really important things to keep our heart healthy, but how do we know if we're on a good path or not? So just like we have grades in school, sometimes we need some feedback to know how we're doing. So know how if we're heading towards health, if we're heading towards some things that would make us unhealthy or lead to further consequences. And so we do recommend an annual physical. So coming in every year to see us, to make sure we're staying on top of your health, make sure we're meeting all of your preventive guidelines. There are some things that contribute to your heart health that we can't change. So we can't change your age. We can't change, if your mom had a heart attack, if your grandma had a heart attack, those are things we can't change, but there are things that we can change. So we can change your blood pressure. We can change how you're eating. We can change some of these other things. And so that's why we call them modifiable risk factors. And so in the list there is all the things that we know contributes to an unhealthy heart. And we know that we can help you to lead you towards a healthier outcome. So we recommend you get your blood pressure checked every year. The goal is less than 120/80. Depending on your age, sometimes for older people, it's a little bit older. We recommend screening for diabetes in some certain populations. And you can see the numbers there of what's normal and then what is pre-diabetes, which means we're kind of heading in that direction, and then diabetes. We recommend screening for cholesterol. And we care about cholesterol because we know that people with higher cholesterol have a higher risk of a heart attack or stroke. And we want to prevent that for you. And so we can't fix what we don't know. And so that's one of the reasons why we recommend coming in for regular blood checks so we can see how your cholesterol is doing. And then weight. So weight is an important thing too. And if you're tall, then you might weigh a little bit more. And if you're shorter, you might weigh a little bit less. And so that's why we take into account your height versus your weight, so your BMI. And we help to determine if you're at a healthy BMI or if you're overweight or obese. And all of those are risk factors that contribute to heart disease. So those are some of the things that we are able to do for you here at Cucamonga Valley Medical Group. And thank you so much, Sabrina, for allowing me to participate.
Thank you, Dr. Perry. Yes, and Dr. Perry brings up another great point, is that it's important to talk to your healthcare provider. You need to talk to your healthcare provider. Remember that this is not medical advice. You have concerns, it's important that you talk to your healthcare provider. Okay, so thank you, Dr. Perry. So remember that taking care of your heart means recognizing your risk factors and making the necessary changes. And you can take care of your heart by eating for better heart health, doing intentional activities for stress management, and getting your preventative exams. It's important to mention too that when making lifestyle changes, it's always recommended to make one change at a time. So focus on those little things that you can do each day, and they're going to have a big impact on your health. So don't wait until it's too late. Care for your heart now. Okay, so that's the end of our webinar. I'm going to go ahead and open it up for some Q&A. Someone has asked how important is sleep. Sleep is vital. Sleep is vital to our health, to our heart health. Last month's webinar was about sleep hygiene, and I addressed how important sleep was for us, but it's especially important for our heart health because when we sleep, our body gets to repair and re-energize and restore itself. So if you're not getting enough sleep, then that means your heart is not being able to have enough time to repair and re-energize and restore itself. So it definitely can negatively affect your heart health. You want to make sure you are getting 7 to 8 hours of good, uninterrupted sleep. Those are the recommendations. Do we have any more questions from our attendees? You can go ahead and enter them now. Someone asked, do we offer any help to quit smoking? That's a great question. Thank you for bringing that up. We actually offer smoking cessation classes, and these classes are geared just for that, to help you quit smoking. So if you're interested in that, that's a great resource, and I recommend to talk to your healthcare provider, and they'll be able to help you get into one of those classes. Someone asked, does a glass of red wine at night really help your heart? So I have read this question a lot, especially during my research, and I'll say that I'm not going to say it's extremely helpful. I would rather you eat that fiber, choose those better for you fats, get some exercise for your heart health. But having one glass of wine at night, I don't see that negatively affecting your heart. Of course, we need to be aware of excessive alcohol consumption because that actually increases the plaque buildup in our blood vessels, which we have learned is going to lead to heart disease. So that's a great question. Thank you for asking that. Someone asked if there is such a thing as too much exercise for your heart. And you know what? That is a great question. I would say, of course, you don't want to push your body past its limit, right? You don't want to do that. If you are working out day in, day out, and you are just exerting yourself, then that's not going to be a healthy thing to do, right? So I would say, of course, push yourself in the gym, get that workout in, but don't overdo it. Know your limits, listen to your body. That's a great question. Thank you for asking that. Do we have any more questions? I am here. I am ready to answer any questions you may have. Someone asked, how do I know, is there any signs of heart disease? Is there any signs of heart disease? That's a great question. That's a great question. And you know what? From my understanding is that heart disease can manifest in like chest pain. So maybe tightness in your chest, discomfort, shortness of breath. If you're doing an activity and you find it abnormally hard to be doing, then that might be an indication of heart disease. Maybe feeling dizziness, so maybe a symptom like that. But definitely talk to your healthcare provider. Talk to your doctor. They're always want to help you. They are there to listen. The power of communication. So please talk to your healthcare provider. That way you can get the best care, especially if you're having any concerns. Alrighty. We are not getting any more questions in. Well, thank you all for your participation. Thank you for asking questions and being here today. Next month, Healthy Living topic is about sexual health. So that's going to be fun. We're going to be talking about how to maintain sexual health, understanding that it's more than just the absence of disease. So we're really going to get into depth about how you can maintain your sexual health. So please join me for that. Remember to check our website for upcoming topics and any more information on joining this program. Well, I hope you guys enjoyed this webinar tonight. If you have any further questions, please reach out to us through our platforms. We are always available. And thank you all. Thank you. And I hope to see you next month. Have a great night, everybody.